Okay, well, thank you so much for tuning in to this presentation today. I wish we could have been in person. I certainly would have loved to see all of you. And I hope that you're truly doing well. This has been a hard time for everyone, and especially for parents of children with special needs. So thank you if you're taking time to do some education at the same time that you're taking care of your children. So today I'm going to talk about chronic pain assessment and procedural pain management specific to our patients with Rett syndrome and what you can do as a parent. My name is Chantel Burkett. You might know me as Chantel Barney, but I just recently changed my name. I'm the clinical scientist of our Pain and Comfort Research Program here at Gillette Children's Hospital. So I'm going to start by sharing a video about a child who has special needs and chronic pain. This was put together in the UK by a qualitative researcher who partnered with parents to really try to shed some light on what it's like to be a parent of a child with chronic pain who has no ability to share. So we'll jump right into that.
This is Lily. She's wonderful and beautiful, and I love her to bits. But she's not like other kids. She's complicated. She needs a whole heap of care. And she has pain. Mostly, I manage it fine, but there is always pain. How do I know that she's in pain? When she can't talk to me, and she reacts differently to other kids. I just know. I read her position, her eyes, her cries. I'm her mum. I'm expert in her, the best translator she's got. But this pain, wherever it is, whatever's causing it, is new. I think I've tracked it down. It's her leg, I think. It's getting worse. How do I convince the clinicians that Lily is in pain? That at the moment her epilepsy is not the big deal. This pain is. I'm working on gut feeling, but I know. The words I'll use to explain will be crude and clumsy. Metaphors. But knowing isn't enough. The best clinicians accept that I have a special kind of knowledge, acquired over years and years. They reach out to parents like me, learn from us. The best, pause. The best, listen. The best, look. They blot out the noise of everything else about Lily. They trust me and my instincts. They believe me and my gut. They find her pain. They ask me what might work. Lily's pain will never be easy. For her, for me, for her clinicians, but together we do our best. We work things out.
This same group has put together some worksheets that can help you as a parent to know a little bit about what you can do and what your role is as a parent and help you prepare to share your experiences with your pain providers. I'm just going to hit the highlights of that pain resource and we'll share those with you as well along with this presentation. So they note, and what we have also found in our research, that the main sources of pain are muscles and bones, tummy and gut. Infection, pain from equipment like wheelchairs and splints are often areas of pain for children with special needs, including Rett syndrome. In this fact sheet, it talks a little bit about what the important things you can do are, and the first thing I'm going to highlight is what they say here, exactly, trust your instinct. You know when your child has pain. If you've ruled out other things that could be going on, and then trust your gut. If you feel like it's pain, it probably is, and speak to your healthcare providers and ask for help. Tell them why you're concerned, explain what you've seen, the changes that you've seen in your child, and stand your ground. If you get some pushback, you can keep advocating for your child. It's not a fun place to be, but you can certainly advocate for your child and get the care that you need. Certainly a great place to start is the Rett Clinic here at Gillette, where Dr. Beising is certainly well prepared to talk about that pain with you. It's also important to know how your child shows those signs of pain, and we've seen all of these in our research studies looking at pain in our girls with Rett syndrome during the pain exam and the sensory test if you've been involved in those studies. And we found that when parents report what they think their child does to show pain, that they align very nicely. So you all know the different signs of pain that your child makes. And I think it's important to remember that the more you get experience throughout your child's life in understanding the way that your child shows their pain, the more confident you will be in taking that to your provider and sharing that you know that your child is in pain and that you need to do something about that pain. So now I'm going to go into how we can assess pain and what you can do in your own home and as parent or caregiver to document your child's pain and to be able to bring that to your provider. So the pain scale that we've put together at Gillette allows you to note pain intensity, pain interference with activities, as well as any nonverbal pain-related behaviors, so you can quantify it. So this is what it looks like. We're just going to zone in here. This is how you would see it in clinic, but you don't need to worry about that top part when you're doing it at home. So keying into the very top part of this pain scale, it's looking at your pain rating in the last 7 days for pain at its worst, at its least, at its average, and pain right now. It's really important to know what pain is like. If your child ever gets a break from that pain, we want to see a 0 there for pain at its least, hopefully. And pain at its worst, when that's really high, we know that we need to be providing some interventions, and what those interventions might relate to that pain at its worst score. So those are all really important for your provider to see and for you to be able to track. We also know that pain interference with activities is really important and a very key part of being able to see how the pain is impacting everyday life. So wanting to know how pain interferes with mood, for example, mobility, sleep, enjoyment of life, those are all really key factors. And it gives us a nice look at how the pain is impacting not just your child's life, but probably how it's impacting the whole family's life and what needs to be done. So for example, if you see that sleep is impacted, that tells your provider, okay, maybe we need to get some resources around how sleep is being managed. And then on the back of this profile that we'll be providing to you to look at in your own home, there's what's called the Pediatric Pain Profile. This was developed in the UK, and it allows us to assess the different nonverbal signs of pain that your child might show and quantify that. So for example, whether your child grimaced when they had pain, or you saw a frown, or they're restricting movement, that you can quantify the severity of each of those pain signs, and you get a total score at the end that you can track over time. And then this shows us how you score it. So if your child is a little cheerful in the last 7 days, or the last week, last month, whatever you decide to use as your time frame, then you just score it on the right-hand column. If you feel like there was something that you weren't able to assess, for example, maybe they hadn't eaten in the last couple hours or whatever the time frame was, you can put a 0 for that item. And then you end up with a total score down at the bottom. It'll tell you at the very bottom right-hand corner what that score means, so you can make judgments. So if your child has a score of 14 or higher, that's clinically meaningful pain. So there are some items on this scale that you'll say, well, maybe that's not pain, maybe they're just crabby or they didn't get enough sleep. But if it rises to a 14 or higher, we know from lots of research studies with lots of participants that that would be considered meaningful pain. And there's also a summary graph included, which I think is really beneficial for parents to be able to track their child's pain over time. So you can score your child's pain like for today. You can kind of adapt it to what you need, whether you're scoring it once a week or once a day or something, but then you're tracking your child's pain consistently and seeing what it normally is, what it kind of is at baseline. And then maybe if you drop in a treatment, you start a new medication or you start doing more stretching. And then you see how that changes the pain as you're scoring it over time. So for example, in this scenario, you'd kind of see, okay, well, it's kind of staying the same. So maybe this intervention that we've tried isn't really helping. Whereas you can see in this scenario, you're seeing a drop in those pain scores. And so you can say, okay, this is really helping. So I think it helps you make those decisions about whether what you're doing is having an effect or not, or even if it's making the pain worse. That would be really important to know. And so like I said, the scale is allowing you to specify how often you are assessing the pain and what the time frame is. So that's really nice. So sometimes people will look at it the same time every day. Maybe you rate your child's pain every night before bed, or you might do it every Monday night after dinner, so that you're looking back at that whole week, or you're looking back at just that day, or maybe you're just looking at a specific hour every day, whatever works for you that you can kind of fit into your family's schedule. Maybe you want to take a look at when you're seeing these pain signs versus when pain signs aren't present. You see you're having a good day, maybe you want to score it and see what your score looks like on a good day, and then score it when it's a bad day, so that you kind of have both of those baselines. That's a good way to get started as well. And then can really inform then when you're having another bad day, potentially you can say, okay, well, this aligns with when we knew that she was having pain, and can inform your decision making at that time to help rule out what other things could be bothering her. And then, like I said, you can track before and after an intervention, and that could be a simple thing like, okay, we gave her Tylenol and we're going to score this pain scale again 30 minutes later and see if the pain score has changed. It could be informing a big decision like surgery of like, yep, we consistently see the pain is high. Maybe we do consider that surgery. Or maybe you are thinking of trying a new type of physical therapy, or maybe you get a new wheelchair and you want to see, does that impact the pain scores? And then maybe if it doesn't, maybe you need more adjustments to the chair. So it can help make some of those decisions a little easier. And I really think it can guide your discussions with your provider in a very meaningful way. So there's a lot of research showing how complex those interactions are. So first, when you have a child who's in pain, just that communication between the child and the caregiver is so complex. We're not going to dig into the graphic here, but just to show that there's so many things going on, like your personal experience with pain, your child's past experience with pain, the situation, there's so many things that go into just that communication, not to mention that the child could be nonverbal, could have limited ways of showing you that they're in pain. So it's a very complex process just to get that information from the child to the caregiver. And then this is the model of just a typically developing adult having that conversation with their doctor of how complex that is, of what they're rating their pain as they're expressing it, as the doctor believing them, as their trust between the doctor and the patient. That's a very complex process, as you can see in this graph. And then some people have looked at, okay, now if the parent is getting the message from the child and the parent is then communicating that to the clinician, that's an even more complex task. So you can see how having something like this on your side of like, I've been measuring pain using a validated pain scale, and this is the scores that I'm seeing. And I don't think that what we're doing is working. I think that this is a very tangible conversation where it's going to be understood and believable, and it's going to cut down on some of those many factors that can go into that conversation. So I think it can really build trust and build trust in yourself too, of like, I know what I'm seeing and I understand it, and something that's so complex to decipher. So I think it's really can change that interaction. And then actually, as you try different approaches to help manage your child's pain, you can actually measure how well those interactions or those interventions are working as well, which can help provide support for what you're seeing. So for example, maybe you're applying heat or cold in a consistent way. You can rank that, and we have this handout for you as well, from that didn't help at all to 10 that completely relieved the pain. Massage, how well does that work when you tried it? And you can kind of track what's working and what doesn't work. And you can specify that per type of pain too. Maybe when there's GI pain, maybe a certain intervention does work. Versus when it's like a hip pain, maybe you need a different intervention that works better. But it can help you track what you've tried and what's working and what's not working. And then this handout also allows you to kind of try combining different strategies and see if the combination of several strategies, that maybe you use cold and massage or heat and massage and ibuprofen, and that actually gives you more relief compared to one of those strategies alone. So it'll allow you to help track what those interventions are that you're trying together and how well they're working, and that's your judgment of how well they're working. But just to keep that in mind and be able to have kind of that objective history, so that you're not just kind of guessing every time or trying to remember, well, what did we do last time that she had this type of pain? I think it can be helpful. So when pain is chronic, these are some things I just put together just from my general knowledge of the research literature. And what a lot of people will say is trust your instinct. Parents do know. You're our best assessment method of knowing your child, your daughter, and what they need. And so trust that and be confident in yourself. You can be even more confident in yourself if you're able to take some time to measure that pain using a validated pain scale that you can then bring to your provider. I think it's important to think multidisciplinary. There's lots and lots of evidence now that really chronic pain needs to be approached from multiple different aspects. I heard someone at Boston Children's just a week ago or so talk about how he relates it to being like a water balloon that has 10 holes in it, and you have to plug all 10 holes with your 10 fingers, and each of those is a different area of physical therapy or orthotics or sleep, and try to kind of approach that pain from all different aspects of the child's whole well-being. So I think these are some things that you can consider, and I think starting out Rett Clinic is already multidisciplinary. Art and Tim know your daughters, and can be that first line of intervention from a multidisciplinary perspective, and they can help you reach out to other areas like sleep, or like Todd Dahlberg for palliative care, trying different non-pharmacological approaches as well. So I think that's a great way to have your mind open to trying different things. And I love to point out, get support for yourself. We have a ton of research that's mounting now showing that how the parents and caregivers are doing really impacts the child. So don't put yourself last. Get the support that you need to be your best self, and that's actually going to really impact your child and their pain. Certainly attend to sleep issues. Sleep is a huge factor. When we aren't able to sleep, it makes everything worse. So that's a good one to try and intervene on early to make sure our kids are sleeping well. That helps them to be able to cope with chronic pain. And like I said, try new approaches, combine approaches, and measure the effectiveness. It'll help guide you. And I say try not to, because this is really hard. I've had family members with chronic pain myself. It's hard not to panic, to stress, to let it get to you and assume that the worst things are going to happen. It's hard not to be constantly searching for answers and talking about the pain and trying to solve it. But we actually know from research evidence that all those things actually make things worse. Doing the things that you can do and that you can control, great. But then trying to relax, focus on other things, still have fun as a family, still de-stress. Being stressed and worked up yourself isn't gonna help anything. So trying to do what you can do, and then try to focus on other areas of life is important too. And then especially as a mom, I can see why you would want to protect your child from having pain by restricting activity that causes pain. But we actually know from research also that can make it worse. So trying to still encourage doing fun things through the pain, still being social and being at school and doing all the things that they can to a reasonable level that you've worked out with your provider is important. So now I'm going to switch a little bit to talking about procedural pain and how we can manage that as parents and caregivers, and to be a strong advocate for your child to get through challenging procedures as best that they can. Unfortunately, girls with Rett and boys with Rett probably have a lot of painful procedures, more than their typically developing peers. And so the more that you can have a positive experience each time transfers to the next time as well. So Buzzy is a new tool. You might have experienced it or used it yourself, or had it here at Gillette. And it is to help with needle pokes. Research shows that it reduces anxiety and pain related to injections. It works for kids and adults. Just to be sure not to place it on a shunt or a VNS device is important. But what it does is it applies that cold and that vibration at the site of the injection of the needle, and that confuses the nerve fibers. And so the nerve fibers are overstimulated, and so they don't process the pain signal as well, which is good. So it is important to remember that the ice wings provide about 60% of the pain relief. So if you take anything away from this today and you use Buzzy, make sure the wings are frozen. That's really important. You can transport it to your doctor's office with an ice pack in like a lunchbox or something. Make sure there's pressure applied with the Buzzy and the ice pack onto the skin so that it is really experienced by your child. So we do actually have a video that was made at Gillette by my colleague Shannon, who has also helped put a lot of these slides together. So we'll show that.
Hi, I'm Shannon Weir. I'm a child life specialist here at Gillette Children's Specialty Healthcare, and today we are going to be talking about a pain relief tool called Buzzy. Insert the ice wings into Buzzy. The ice pack wings should be frozen solid for the most effective results. Place Buzzy directly on the injection site and turn on the vibration. Leave Buzzy in place for 15 to 30 seconds, then slide upward, placing Buzzy between the pain and the brain. Administer shot with Buzzy's round bottom closest to the injection site. Place the dot closest to the shot.
Buzzy makes the pain go away. It's no biggie with Buzzy.
So another thing that you can do is a comfort hold position. This is something that can work for very young children as well as older children. And so they're able to basically sit up while they're experiencing a needle or a painful procedure. Often the first instinct for providers is to hold children down while they're doing procedures. That's just been the history of how things have gone, unfortunately. It makes it a little easier for providers to safely conduct the procedure. But it provides it causes a lot of pain and anxiety for the patient and your child. So the more that they can sit up and be held in a comfortable position, the better their experience will be. And you can actually keep their body safe and help them feel supported and secure during the procedure. I will, based on my own experience, discuss with the provider ahead of time and make sure the provider is going to signal to you when to hold tight, because it's easy to just be kind of lightly hugging your child and then they jerk as the needle's going in, and then it can go poorly. So just try to work that out with the provider ahead of time, especially when they're not 100% on your side about wanting to do it the way that you want to do it, that they're going to signal to you in some way that's not too obvious, hopefully, of when to squeeze and hold your child tight. Because often when you go to like a regular pediatrician for a flu shot or the COVID shot, or just routine immunizations, they're not always super excited to do it differently than how they've done it before. So it's good to advocate for your child. Just let them know this is how I want to do it. And we have the handout that you'll have. You can bring that with you if you want, and try to advocate for your child. And it might be the first time that provider has done an injection that way, and so it might be stressful for them as well. But you can be a leader and showing them that things can be done differently, and that will benefit not just your child, but other children that will come through as well. It's hard to have those conversations, even for me, but it's worth it if you can start to have an impact and make things a little better. If it doesn't go your way and your child has to be supine and on their back and held, as soon as you're able to hold, pat, comfort your child after the procedure and reassure them and praise them for doing well as soon as possible. And just because some of you probably still have young children or may have new children still in the future, if you do have an infant, breastfeeding is really, really beneficial. And there's tons of literature to support that breastfeeding your baby during those consistent early injections that happen every few weeks, it seems, when you have a newborn baby. Breastfeeding during that. Start breastfeeding a few minutes before the injection and then try to get the baby back to breastfeeding as soon as possible. Again, you'll probably get pushback from some nurses that'll say like, oh, they might choke or they might move and the needle will hurt them. But that's actually really not been proven to be the case. There's no evidence to support that actually happens. And actually all the evidence shows that it's very successful when you can hold the baby and have their leg exposed to have that injection. So we'll just show also briefly the comfort hold positions, but you'll also have that as a handout available to you to use to review which ones might work best. It shows which ones might be good for like a face procedure versus an arm procedure versus a leg procedure. So it kind of guides you through what might work for your child. These are things that should be available to you that you can certainly ask for. Maybe they won't be available, but you can ask for cold spray, J-tips when you're having an IV, warm blankets definitely help with IVs and blood draws, and then sugar water or sweeties for infants. Those can all help make the experience go a lot better and are all evidence-based practices to reduce the pain for your child. And then something I wanted to share with you is a grounding technique, which can help with coping with anxiety. And I think this is something, again, back to like the better that you're coping, the better that your child is going to cope. And so even if you're doing this for yourself, maybe I picture doing this maybe while you're waiting for the nurse to come in with the shots, or while you're waiting in the waiting room and things are just elevated. You can do this and say the things out loud and help to calm yourself and your child. So it's really just a roll call of things you're seeing, touching, smelling, hearing right in this moment. It just engages your senses to help bring you back to the present moment. And it will help make a difference, and it only takes about 60 seconds. So you can do it either as something that you're seeing right now or an imagined happy place. Maybe you and your child can have a happy place that you like together. Take a deep breath, and then you think of 5 things that you see. So maybe that's I see the trees, or I see a teddy bear, or I see grandma. 4 things you can feel, like I feel the carpet, I feel a soft kitten. 3 sounds, like I hear birds singing. 2 scents, so maybe that's an imagined scent, like warm cookies coming out of the oven. And a taste, so probably a favorite taste like ice cream or something like that, if your child has something like that. You can also do this in a quicker fashion and just do a couple of them, whatever you have time for, but make sure you take that nice big breath. And if it helps you be more calm, it will help your child. Distraction is an important way to get through procedures as well. Some ideas are shown in this picture, like count, but there's also like counting backwards and forwards. You can bring a favorite toy to a procedure, or maybe have a new toy available for your child to play with for the first time. You can talk about things your child likes, if they really like, I don't know, whatever they like to do. If they like a certain TV show, you could talk about that, or you can actually show that on videos or on an iPad, have that going and during the procedure and see if that's helpful. That's something that's important, is evidence shows that you want to distract when the child's calm enough to engage. If your child is escalated, then it actually makes it worse. So it's okay to comfort and calm for a little while and then try to distract. And if the distraction doesn't work, then just comfort, calm, kind of match your child's tone, and let them kind of de-escalate a little bit, and then try to introduce the distraction to kind of get back to normal. And I say it's okay to cry. That's for moms too. It's okay for us to cry sometimes, but it's also okay for your child to cry. It's developmentally fine. It is a tough experience. It's okay if they cry. You just try to get them through it and back to baseline as quickly as possible. I wanted to make special note of this. It's called a lullaby. We've gotten some here at Gillette, and they've been actually fantastic for patients of all ages and abilities. It's meant for newborn babies to go under their mattress and provide some vibration, but actually just wrapped in a blanket. This you can get on Amazon for, I think, $25. But it's nice just as a comfort tool to have, maybe in a blanket or in a pillow, vibrating just as something kind of comforting. We've seen a lot of benefits of using it with patients during procedures. You don't want to leave it on and just leave it with your child for a long period of time, but just as an initial, like a few minutes before the procedure, during the procedure, it can be quite comforting. So that's an option available. You can also get the Buzzies if you want to have one on your own. They're on Amazon they're about $75, but you can bring that with you to your provider yourself as well. Try to avoid reassurance. This is really a hard one, but there's a lot of research showing that when you reassure your child, it's almost like telling them like they should be upset because you're saying it's so bad that it's almost over, basically. But it's really hard not to do. I actually just did it. My son just got a cast off, and I found myself saying it's almost over, just one more thing. So it's really hard not to do it. So it's just something to think about and try to reduce. Like I said, take a deep breath for yourself, try to keep yourself calm, and as soon as you can after, reinforce, praise their coping skills. It's shown that we can reframe our experience for yourself as well as your child. You were so brave. It was tough, but you did it, trying to show them that they coped and they got through it, and good for them. And just remember, you can ask and advocate for your child. You should have a calm, quiet environment when you're having procedures, and it's okay to speak up and ask for that. If too many people are talking, it's okay to speak up. It's okay to ask for child life if you feel like it's going to be a difficult procedure for your child to get through and child life might be available. Ask for it. You can ask ahead of time too, to make sure that's lined up, hopefully. It's okay to ask for a trained phlebotomist for blood draws. This is something I'm quite passionate about. Lots of people can do blood draws, but phlebotomists do them 100 times a day, and it is a skill that you need to practice. And especially for girls with Rett, where blood draws can be very difficult, it's okay to advocate and say, I want a trained phlebotomist. And we know warm blankets during blood draws really help, so it's okay to ask for that too. And like I said, it's not always going to be available, but at least speak up and ask and see what they can do and arrange for you. Same with cold spray, J-tips for IV starts, and topical anesthetics are all evidence-based approaches that you can say, I know that there's evidence that this works and I'd like to have it if possible. And remember, if your child cries, it doesn't mean you weren't successful. It's a learning process for you and your child, and you'll just maybe keep getting better at it and it'll get better. But it's also appropriate for your child to cry a little bit. And if professionals don't support you, you're not alone. I do all of this all the time, and it's hard for me when I go and take my kids to have injections or blood draws, to advocate for all the things and to push back when people tell you like, oh, we don't do that here in the community, and to say, you know what, I would like to have that done. People don't always listen, but it takes, it's going to take a while to see a shift in the medical care of our children, especially our children with special needs. So we'll keep working on that. So just some summary statements here, and I think I just kind of wrapped up all of these things, but just like I said, keep trying, keep working to make the procedural pain better each time. Just do what you can do. You're doing your best. If you've tried to do a couple things, it's not going to go perfectly, but if you've done a couple things to advocate and try to make it better, then that's really successful. And with chronic pain, just again, trust your instincts, ask for help, and make sure you're taking care of yourself as well. So I think that's all I have. I would love to hear from any of you or all of you if you have any questions, comments, discussions. Certainly if you have any feedback from experiences that you've had at Gillette or things that you feel like you need, I'm happy to have conversations and would love to hear from you. Thank you.